As a teenager, Alicia was shy and riddled with anxiety. At 15, she tried weed and alcohol for the first time and felt her anxiety melt away. She discovered that being high made her loose and funny. She liked that version of herself more. When Alicia was 22, she met her boyfriend, who encouraged her to apply to cosmetology school and to set up an appointment with a psychiatrist who prescribed medication for Alicia's depression, anxiety, and OCD. Things were looking up for Alicia when one day she went to the emergency room because of a painful staph infection. She left the hospital with a prescription for Percocet, a medication containing oxycodone, an opioid pain reliever. Alicia started by taking the amount prescribed, but soon she became curious what would happen if she took a little more. She decided to sniff the pill, and the effects became much more intense. The body naturally produces endorphins in the reward circuits of the brain. Opiates treat pain in two ways. They attach to opioid receptor proteins and block pain messages sent from the body through the spinal cord to the brain. Opiates also stimulate dopamine release in the reward circuit of the brain. Alicia began chasing the euphoria she felt on her first high. She was hooked on her Percocets. The brain balances its natural endorphins similar to a thermostat. When an external source floods the brain, that steady system is thrown off. In other words, the more you take the drug, the more the brain adapts to it and demands more. As Alicia's tolerance increased, she got less pleasure from the pills. She was now taking Percocets just to feel normal. When she ran out of Percocets, she had already become both physically and psychologically dependent on them. When the body's used to functioning with the drug in the system, without it, withdrawal symptoms appear. Symptoms like vomiting, crippling pain, and debilitating anxiety and depression. Alicia experienced high levels of irritability and stress. She began fighting with her boyfriend, who suspected she had been using drugs. The brain has adopted a compulsive habit and is begging for more drugs. Blinders go up, and the only thing that matters is getting the next fix. Alicia was constantly miserable, nauseous, and sick. Her illness prompted her to take an at-home pregnancy test. Getting a positive result, she retested at a women's clinic. She was 4 months pregnant. Hearing the news, she enrolled in drug counseling and began taking methadone, a synthetic opioid painkiller. Medications like methadone bind to the body's opioid receptors to prevent withdrawal symptoms. Over time, this helps reset the brain's pain thermostat. Opioid abuse is the abuse of pain relievers that are derived from the opium plant or man-made using the same chemical structure. Proportionately, the opioid epidemic has hit the young adult population the hardest. Opioid overdose deaths among women is a growing problem. Subsequently, opioid use among pregnant women has also increased, with a disproportionate rise in rural areas. For someone who is drug dependent, adherence to a birth control regimen is difficult, helping to explain why nearly 90% of pregnancies among women who abused opioids were unintended pregnancies. Methadone has been shown to help pregnant women bring their pregnancies to term. However, since methadone is in the same family as opioids, fetuses are still exposed to opiates. Alicia gave birth to her son Jackson, who was diagnosed with neonatal abstinence syndrome, a group of conditions caused when a baby withdraws from drugs that they were exposed to in the womb. Experts believe that a baby suffering from NAS is born in the U.S. every 15 minutes. Research on the long-term effects of NAS are limited, but may include developmental delays and vision and hearing issues. Babies are tested for NAS using urine and meconium tests and the NAS scoring system, a compilation of tests to grade the severity of the condition. Most babies with NAS get treatment in the hospital and get better in a few days or weeks. Treatment for NAS may include medicine to soften withdrawal symptoms, IV fluid to help with dehydration, and high-calorie baby formula to help with growth. It is important to differentiate opioid use in the context of medical care, opioid abuse, and untreated opioid use disorder. Universal screening for substance should be done at a pregnant woman's first prenatal visit. For patients who used opioids during pregnancy, there should be a long-term follow-up including medical, developmental, and social support. Infants born to women who used opioids during their pregnancies must be carefully monitored and tested by a pediatric physician for NAS. Addiction is a mental illness. A case-by-case and multidisciplinary approach must be utilized to give these women and their children the best chance for life.